Hi there. Welcome to the While You Wait podcast, where it's all about helping women just like you learn about the bladder while you're waiting for your appointment with that specialist. Each week, I'll combine science, medicine, and common sense so you can learn, become empowered, and get started on your journey to dryness. I'm your host, Dr. Sarah Boyles, a board-certified urogynecologist. Let's get started. This is an excerpt from a lecture that I gave recently called The Promise of Stem Cell Therapy for the Pelvic Floor. I hope that you enjoy it. I just want to say that this lecture is for education. It is not medical advice. I'm going to be discussing a few things. I'm going to start by talking about what are stem cells. Then I'll talk about what is the stress incontinence data, and then what is the data for other pelvic floor disorders. So, what are stem cells? Stem cells are cells that are capable of self-renewal and can differentiate or change into a range of cell types. They can also promote the release of cytokines and progenitor cells that create the right environment for a particular cell to grow. So this means they can change into specialized cell types and create the optimal environment for themselves by releasing specific factors. There are different forms of stem cells. There are pluripotent stem cells that can differentiate into all three germinal layers, endoderm, ectoderm, and mesoderm. These are the stem cells that are derived from embryos. There are ethical concerns here, as well as safety concerns about these cells differentiating into cancer. These are not the stem cells that we're talking about here. Rather, I'm going to be talking about multipotent stem cells, which come from adult tissues and can differentiate into specific cell lines. So they still do amazing things, but they do not come from embryonic tissue. These adult tissues contain mesenchymal stem cells, and they have several advantages. Mesenchymal stem cells are important for repairing skeletal tissues, and they can become bone, cartilage, muscle, or fat cells. Some of the benefits of these cells are that there are a lot of them. There are less concern for tumorigenicity or malignancy. They have enhanced proliferation and differentiation capability compared to other types of adult stem cells. They release cytokines and growth factors, paracrine factors, that create beneficial effects by changing the local environment. So they can also alleviate inflammation and stimulate blood vessel formation. And these mesenchymal stem cells can be found in bone marrow stem cells. They can be found in fat. They can be found in cord blood and amniotic fluid. They can be found in urine. Once the stem cells are harvested, they are prepared, and the way that they're prepared is different in different labs. The cells have to be isolated so that you just have the cells that you want. They're generally then suspended in a special media with added cell types to enhance the desired characteristics. They're then suspended in a scaffold and serum. Much of this information can be proprietary information to the lab. And stem cell therapy may seem like it's something that's very futuristic, but I would just remind you that stem cell therapy actually started with bone marrow transplantation for myeloproliferative disorders like leukemia. And then once that was proven to be an effective therapy, there was ongoing research into stem cell therapy for autoimmune disorders, cardiovascular disorders, and spinal cord injury, and now stress urinary incontinence. So before I talk about the data for stress urinary incontinence, I just want to say that I focused only on human studies and only on female studies. There is more data on stress urinary incontinence than there are the other pelvic floor disorders. And that is really because it is a much simpler model than some of the other diseases. In this research, there are different stem cells that are injected, and then it can be injected in different ways. It can be injected transurethral or periurethral. The way the stem cells are prepared is different, and what is injected with the stem cell can also be different. So just to remind you, stress urinary incontinence is common. Half of all adult women leak, and studies have shown that a third of women aged 30 to 50 have stress incontinence. Stress incontinence is leaking with exertion, so coughing, sneezing, exercise, and it can be secondary to urethral hypermobility or sphincter dysfunction. The most common ways that we treat stress urinary incontinence currently are with pelvic floor strengthening, pessaries, urethral bulking procedures, and surgeries. Surgeries with mesh slings are the most effective treatment. The treatment or cure at 1 year is 85%, but it is not without healing time and some risk, as all surgeries are. Mesh also has the unique complication of erosion, which happens 1 to 2% of the time, and mesh is not acceptable to some women. So there's always a need to improve our treatments and to improve what we're doing. When we talk about stem cell therapy for stress incontinence, we are using your own stem cells. So these are autologous derived stem cells. And this appeals to a lot of women because it's your own tissue. And the thought initially is that these stem cells regenerate the urethral sphincter, and they also restore urethral function via paracrine effects. So these studies have been going on for quite some time. There was initially a pilot study that was done in 2014. 5 women had a transurethral injection of autologous adipose stem cells, so fat cells with collagen. And they were tested with a standing cough test and questionnaires at 3, 6, and 12 months. And they found that 1 out of the 5 women had a negative cough test at 6 months, 3 out of the 5 had a negative cough test at 12 months, and all had some subjective improvement. So this showed that there was definitely some potential with this type of therapy. In 2017, 10 women had a periurethral injection of autologous adipose stem cells and collagen, and there was found to be significant improvement in pad tests and questionnaires. There have also been studies looking at muscle-derived stem cells. The first study was done in 2008 with 8 women, and at 1 year, improvement was seen in 5 of the 8. Of note, the onset of improvement was 3 to 8 months after the injection. In 2013, 38 women had muscle-derived stem cells injected at varying doses. And this study found that the higher dose resulted in a more effective treatment. So 90% of the women in the high dose group had a 50% decrease in pad weight versus 62% in the low dose group at 1 year. 78% of women in the high dose group had a 50% decrease in reported leaks versus 53% in the low dose group at 1 year. And 89% of women in the high dose group had 0 to 1 leaks over 3 days versus 33% in the low dose group at 1 year. So this showed a dose response, which also helps to support this therapy. The study also found that there were only minor complications like pain and bruising at the biopsy site. There have been several other studies that have shown benefit from stem cell therapy. A study in 2022 showed an improvement in incontinence at 2 years, but there was no change in urodynamics, so no change in measurable function of the sphincter. So no increase in pressure, no change in flow. And this led to question how the stem cell therapy actually worked. So is it an increase in muscle cells, or is it because of local paracrine effects, or is it both? So while initially the thought was that it would be just an increase in the muscle cells, so an increase in the sphincter, there's been additional research that has shown improvements in collagen, elastin, and an increase in neovascularization, improving connective tissue and neuromuscular tissue. The mesenchymal stem cells mediate cellular communication, and this communication may be more important than actually growing a muscle cell. So understanding the cellular component, the cellular communication, will help us improve this treatment. So questions that linger: what type of stem cells are the most efficacious? How should the stem cells be prepared? What is the optimal dosing of stem cells? What should be injected with it? How should it be injected? So transurethral or periurethral. And what happens after 1 year? How long lasting is this stem cell treatment? And currently in the United States, there is a trial that is going on called the Celebrate trial. And this is a randomized controlled trial looking at autologous muscle-derived stem cells compared to placebo for female urinary incontinence. So this is a very exciting new development. So what is the data for other pelvic floor disorders? And right now there is no human data, but there is ongoing animal research for overactive bladder, urinary retention, pelvic pain, and pelvic organ prolapse. So for me as a clinician, I think that this is one of the most exciting advances that I've seen in urogynecology. There's so much work to be done, but we're at a point where we're starting to understand the basics of stem cell therapy and how to improve stress urinary incontinence. And our knowledge will only get more sophisticated over time. There's a long way to go before this is a common treatment, but that research is actively being done. So stay tuned.
Thanks for listening. If you want more information about me or my online work, check out my website at www.thewomensbladderdoctor.com.